Well, hey there, Dr. Andrew Grecki with Remote Therapeutic Monitoring, MovementRX. I said that backwards. It's MovementRX, the best remote therapeutic monitoring platform for physical therapists. I was just doing a little research today after the holiday here, just trying to get my mind back in things. And I was blown away at this article I found in, it looks like it's in the 2018 March version of the JMIR. JMIR, what does that stand for? Let's see, it doesn't say. So the JMIR Health Journal. I found this on the National Library of Medicine, so the NIH website, and you can see my screen, I believe, right? So here we are doing a screen share. Hopefully you can't see all my tabs are open too, but I thought this was interesting. The patient involvement with home-based exercise programs. And the question they were posing was, can connected health interventions influence adherence? So that's what remote therapeutic monitoring is. This is in 2018. So now we actually have remote therapeutic monitoring. And I will save you, well, you can read this article if you'd like to. In fact, maybe I'll post a link in this video. But if we go right down here to the conclusion or the results, right? It shows that, let's see here. It shows that a really sad fact here in this study. I'm not doing a very good job at finding this for you guys. The conclusions. Oh, shoot, I'm sorry. It shows that only, let's see, it says estimates of non-adherence to home exercises have rates as high as 50%. So 50% of patients potentially having a detrimental effect on clinical outcomes. Well, no kidding, right? As a physical therapist, you know this. You know that the more that your patients do at home. So it says in the introduction, evidence suggests that non-compliance to these home exercises in musculoskeletal cohorts can be between 30% and 50%, making it a significant issue that places additional burden on patients and healthcare providers and may be partially to blame for poor clinical outcomes, right? It's not the physical therapy, the physical therapist, it's the lack of adherence at home. So we know between 30 and 50% of people are not doing their home exercises, right? That is absolutely unacceptable. What else is interesting here? So this one shows that only 35% of patients were highly adherent. So between 30 and 50% are actually doing it, but only of that group, only 35% are highly adherent in this short-term study with patients with non-specific low back pain. And the study went on to say that 50% of those who received an additional exercise program showed non to low adherence, right? So there you have it right there. The whole point of remote therapeutic monitoring is to impact the physical therapy profession so that patients are doing more of what you're teaching them at home so they get better outcomes. And now here we are with an incentive program through the insurance companies paying us a pretty significant amount to do this program. So if you're not doing this program, you might want to read the study for some more motivation on how to increase your patient's performance and outcomes so you have a better clinic and that physical therapy is around for generations to come.